The show for today. The topic is the Metropolitan Action Commission, and we're talking to the Executive Director of the Metropolitan Action Commission, Mr. Walter Hunt. And of course, Mr. Hunt, before we had our first commercial break, I think we sort of promised that we would give you an opportunity during the second segment to talk about education within the frameworks of the Metropolitan Action Commission. And so let's do that. Let's have you to talk about it from whatever perspective you wish to use.
Well, I think the Head Start program is the most important program that we've ever experienced. It's the only program that I recall surviving both parties, Republicans and Democrats in Congress, and the program has really grown. We, across the state of Tennessee, have served about 1 million students since the program was created. Just across Tennessee. We've done probably about 750,000 right here in Nashville alone. But let me say, first of all, how important this program is, because about 3 years ago, there were no mandatory kindergarten laws in the state of Tennessee. So therefore, the undereducated, some young poor kids did not have an opportunity to go to preschools because they couldn't afford it. So they were sitting at home, for the most part, waiting until they become of age to enter the first grade. By that time, they was 2 years behind. They recognized this years ago, and the program, the Head Start program, although it is a national program, actually started right here in Nashville by a lady by the name of Susan Gray, and she took that concept to Sergeant Shriver in Washington, and it was developed at that point. But since that time, the program, as I said, has grown tremendously. One of the things that we find in a lot as early as the Head Start students is some of the same problems that we see in the older kids today. They have sometimes a lack of self-esteem, lack of direction, because they've not had that kind of training. So when we look at the students that we have put through the Head Start program, they tend to do better in school. They are more adept to learning. They are less apt to get into drugs because they have a greater sense of direction, as opposed to students who do not have that opportunity. Right now, we estimate that there are 3,000 students that we still need to pick up, and that's what if we ever expand, we will go after some additional students, because I think it's important. It's very important. We are doing what we call a transitional study now to see how well the Head Start students are doing in public schools versus the students who didn't have the opportunity to go to Head Start.
You know, I think that's an interesting question. And of course, I think that you've been involved long enough, and I think you've already hinted at the fact that you sort of believe that this program not only is important in bringing those school children into some kind of school setting, but I think you've also hinted at the fact that perhaps this might be an excellent kind of program that bridge that gap. Is that what you're saying? Is that what you're trying to document now?
That's exactly what I'm saying. We're looking at how well the students that attended Head Start perform in the public school system. So our study will go from K through 2. We'll look at that three grades in the public school, and then we'll compare that with the students who did not have an opportunity to go to the Head Start program. But one of the most amazing things about the Head Start program, we get a chance to see it in the reverse. What I mean by that, we have another program at the Metropolitan Action Commission called the Self-Sufficiency Program. These students that we're getting basically are students who are high school dropouts, and their ages range from 18 to 30 years of age. Now, what we see in this group is the same thing that we're trying to give the Head Start students in that group, but this group missed it. So in essence, we are just having to back this group up, realizing that there are adults but we're doing some of the same things for this group as we're doing for Head Start.
They still lack self-esteem, they lack responsibility, they lack the same things that you're trying to start these young children with.
Right.
These older ones simply missed that somewhere. Is that,
and that's absolutely, and that's what we're dealing with now with the students that we have in the self-sufficiency program that are 18 and beyond. At that point, it's just like having to restart them all over again, you know. And once we restart them, the majority of them will do a great job. Matter of fact, we put 22 people or students in college last year out of the self-sufficiency program that did not have an idea that they were even going to school until we recruited them, talked them into them. We have two wonderful instructors, Dr. Collins, she's the teacher, the mom, everything they need. And we give them that basic concept of what learning is all about, and then they take off. Now, when we bring them in there, we have 3 divisions of that self-sufficiency program. If they're reading below a 7th grade level, and we test their reading level with the TABE test, and if they're reading below the 7th grade level, then we will put them in the adult basic education program until we get their reading skills up. After the reading skills get higher, then we'll transfer them or graduate them, as we call it, over to the GED with the rest of them. That in itself gives them the catalyst, the excitement to do a better job over here in the GED, and most of them will do a great job. Now, just before they get ready to take the GED test, we start talking college. Because I have found over the years that I can get all the people in Nashville who don't have a high school diploma and say, come on, I'm gonna give you a GED certificate, and they get the GED certificate, and I let them walk out the door, then they're not gonna know what to do with it. So we have to keep them, track them, carry them further, and that's how we were able to put 22 people in college.
And so you've got an accelerated learning program that's based upon program learning and many other things in terms of testing them, and then with the ultimate objective of perhaps doing the GED and then entering into higher education. Is that
yeah, it's more, it's a more accelerated, but it's still one step at a time.
Okay.
But we just don't talk ABE.
Let me interrupt you here, and of course we'll be back with you.